Hello and welcome to Beyond a Mirror podcast. It has been a while since we broke down the serious conversation with our chit chat with Jean. Hello, Jean. So we decided that today we will be discussing some very important topic, what actually we will consider as a completely red flag in medical aesthetic practitioners and medical aesthetic clinics, and which treatments we personally would never have, because we both have regular treatments, we from different age groups, and we have probably our own personal preferences. So Jean, let's start with you. And in fact, you started as a patient.
Yeah.
So what would be like a bad sign for you and will put you off of having treatment when you visit the clinic or see a practitioner?
So if you remember, before we started working together at Angels 12, I saw you when you just rented a room.
Yes.
So it wasn't the room, it wasn't the building, it was nothing to do with anything as to why I chose to be comfortable. I think the first thing you would look at is, how does the practitioner look themselves? So whether they're male or female, can you relate to them? Do they look as though they've had work done? Is it good? Do they look a bit strange? If they do and you feel uncomfortable with it, I would have just run a mile.
You know, it's so interesting because I would share exactly the same point of view. I think, first of all, is how practitioner presented. And for me personally, I think if they look overdone, that will be absolutely no. I think I would see this person on the street and I just would think why they have done this to their face. But on the other hand, if practitioners look scruffy, a little bit dirty on the scrub, not pleasant smell maybe. I think those things, I think because you promote not just aesthetic but health first of all, and there is a certain parameters that we're looking for, I personally would say.
Definitely. That was definitely the main thing that made me choose. And it was, when I look around now, when we go to different conferences, we meet other doctors and we see people that have their aesthetic clinics, then I do kind of look around and think, would I feel comfortable with them? What does their partner look like as well? Because sometimes the doctors look absolutely fine, but the wives are very overdone. And I know sometimes it is what they want, but sometimes you've got to say no. And that's another big reason that you would look for in an aesthetician, because you wouldn't want somebody that wouldn't tell you, no, that's not right. Because you want to say, what do you think? What should I do? What will I get the best from it? Do you think I should do this? And if they don't think they should say no.
Oh, absolutely. And that is now you kind of going a little bit deeper into the journey. So first impression is definitely important.
Yeah.
But then so you mentioned that it's about saying no, but is there anything else that you will be looking for? What actually will make you to come back to the same place?
I think
or make you not to come back.
So if I felt as though the doctor wasn't giving me the right advice or giving me different options, if I felt as though it wasn't transparent cost-wise as well, I think that's really important. I think the fact that we always do treatment plan that people can take away, I wouldn't want to feel rushed or pressured. I would want to do it in my own time. And if I didn't feel as though that was an option, that would definitely put me off.
Absolutely. And I also, in terms of, would you be looking at, is any qualification or lack of qualification will put you off of having treatment?
I would 100% never see anybody that wasn't medical. I would always want to see reviews. I would want to see photographs, unedited photographs as well. That's another main thing. It's very easy now to change the images that they take. So I would want to see the real proof of their treatment. So if they couldn't provide me with that, again, that would be something that I wouldn't consider. So when this was a path that you decided to take, how did you see it evolving? Really, what was your plan? Did you think that everybody was just going to come and they would just have lips done, or did you always think I would look at somebody's whole face and make a plan?
Oh, I don't think I have ever had in my mind to be a practitioner who focused on lips. In fact, I would say that will be one of the red flags for me for multiple reasons. I think there is nothing wrong to finding your niche, but if you're just doing one thing, I don't think that you're able to offer what we call now 360 approach to aging, because eventually your patient will have just beautiful lips that don't match with the face, or sometimes not so beautiful lips. I always, and my predominant focus always was skin. In fact, my medical aesthetic career started with courses that I learned about skin health, medical microneedling, skin peels, and then a couple of years later down the line, I've added injectables. I think for me, one of the insights of aesthetic and if I would be a patient, or when I'm a patient, I look at someone who has a real expertise at looking at the whole face and makes a plan. I think for me, a practitioner without a strategy would be a red flag. I think if you hear conversations a little bit here, a little bit there, maybe we will tweak something here. No, that is a sign of not professional conversations. I think each area of the face has a name which you need to address professionally and accordingly, and I think you need to have a strategic plan and work with the patient to achieve these goals. Definitely.
And it could be done over time.
Oh yes, absolutely.
So, again, the no pressure. Nobody wants to be put off. Nobody wants to feel under pressure. And if you do, then that's a huge red flag.
Oh, absolutely.
A full treatment plan with a time scale even is something that you would feel very comfortable with.
Yeah, and I think you feel, well, this person knows what they're doing.
Yeah.
Absolutely. What about the prices, Jane? Would you be worried about price if it is too cheap or if it is too expensive?
I would be more kind of worried about price if it was too cheap. I would then be worried about the products that were being used. Where did they come from? Obviously, I know the cost of what we pay for our high-end products in the clinic. So when people ring and tell me that they can get the lips done for £75 down the road, I know that couldn't be possibly what we would use even. So that definitely wouldn't be something that I would consider. And I think as well, I would be even more worried if it was a medical professional that was offering treatments at those kind of prices, because then I would really question their ethics. But then everybody has a budget, and and I would think that most people would say that's what I have to spend, or that's too much, so what can we get the best out of for this much? And if the practitioner is pushing for more than you can actually afford, that's something else that you've got to be careful of that?
I would say pushing practitioner or the person who's very categoric or negative, that also will be a quite big no from me to have treatments.
Yeah.
I think it's about working together, because at the end of the day, it's my face or it's patient face.
Yeah.
And I think they have all the rights to be a part of it.
Yeah. Yeah. And a big red flag would be if the aesthetics are done in a tattoo parlour,
Yes.
hairdressers, that just have somebody that comes in and does it. If the training in these places are done by somebody that's actually a travel agent, has no medical background, how can that be right?
But we need to be careful about hairdressers, because
Yeah.
part of our angels 12
We
we
do.
have a hair salon.
Yeah.
However, sometimes
But what I'm
we
saying
say,
is, if hairdressers actually are doing it themselves, because they do, people that have done semi-permanent makeup training, which is a one-day course, then
oh no, it's qualification, absolutely. And sometimes
Absolutely.
I'm joking that we are the only CQC registered hairdressers,
hairdressers.
because it's our business have different departments. But I think a good hairdresser, a compliment, a result of fantastic
Yeah.
aesthetic work.
Yeah.
And I think another negative sign for me will be, and a big no, a practitioner who's very negative about your current aesthetic situation. Either you have had a treatment somewhere else and have a not brilliant aesthetic result, or sometimes some consultation could be a little bit brutal, and we have some ladies who come to us and they've been somewhere else and they felt very upset of how their face or aging being criticized, and they have been told that they passed the time of help with non-surgical treatment. I think it's important to understand the patient. So someone who makes you feel uncomfortable or upset or puts you down, I would say definitely not will be the right practitioner for me to work on my face.
No. And we treat ladies in their 80s that want to look the best, and
Absolutely.
they do. But again, we did turn a lady away because she'd been poorly, and we felt as though it wasn't the right thing for her. Maybe she went somewhere else and they did the treatments. But I think if somebody has got a medical history that you don't feel comfortable that it's the right thing to do, then you've got to say no.
Oh, absolutely. And I think that is, again, we're coming back that it's important to say no. And also for me, I think it's important to ask what your expectation, what do you like. But I think it's so important that practitioner guides me and puts their expert advice. Because if I would go to a personal trainer, I expect their expertise to guide me to achieve my best body. I would say the same would apply to medical aesthetic. So because you're expecting experts to have done hundreds, if not thousands of procedures and have the right expertise to identify what would be right for your face.
Yeah, absolutely. There are so many things to look for to make the right decision. But I think to feel comfortable and confident in the place that you've chosen, even if you've got to see 6 people before you feel that.
100%.
Do it.
So just to summarize, a big fat no for a medical aesthetic practice or practitioner will be personal appearance of the practitioner. So first impressions, very important. Expertise, so they need to be an expert, have the right qualification, have a gradual development and personal development. So person who have done just one day course 10 years ago, it's a big no from us. And also pushy practitioners who don't respect you, where you don't feel uncomfortable, it's absolutely big no. a cheap price. It's a never good idea, and especially when it's come to a personal health, wellness, and something as important as your face. I never understand why people are attracted by cheap, because you have only one face and it determines how you live your life. And of course, a practitioner without a plan, who doesn't guide you on the journey, who doesn't recommend what will be the best options for you, and who's not able possibly to answer questions that you have, I would say it's definitely a big no from us. And Jane, let's just talk about which treatment you wouldn't have, and it's not necessarily bad treatments, but just not for you.
Not right for me. So I really would advise most of people to have facials to look after the skin, and I do look after my own skin. But the facial that everybody loves at Angels 12 is the hydrofacial. Now, it's an hour and 45 minutes, that treatment, and I can't think of anything worse than that. I just would not relax for that amount of time and enjoy it. By 15, 20 minutes, I would be thinking, is it finished now? I've got other things to do. And so I love skin peels and things because I get a really nice result, but it just takes a small amount of time. Half an hour is probably my maximum of laying there.
Time for relaxation.
Yeah, so it's not that I'm saying that facials are bad, and I really love to see people's skin when they come out of clinic, but not for me. And what about you? What do you think?
From aesthetic point of view, I will struggle to find the treatments that because those that we offer, we test them all.
True.
And I would say each of them is giving a good result when it's prescribed right. But out of those that is not for me, or I would say I'm not looking forward, I have had it only once and had it with very top expert in the country, is threads, and have been very happy with the result. But I would say it's something not necessarily that I would never have, but not something that I would look forward. I think it's also because I know how invasive this procedure is, and you know that even with the best person there is still some risks. So I think that is one of the treatments that I would definitely will be quite considerative. Other treatment, and that is what I advise to many of our patients, we do use a laser pen for non-surgical blepharoplasty, but predominantly we use it for removal of skin tags, treatment of skin resurfacing, and non-surgical blepharoplasty. It's something that personally I think is not procedures that is good value for the money or give you like really long, impressive, long-lasting result. I think for people who really need it, they can just go for surgery. I think but I would love hydrofacial. I could lie for an hour, 45 minutes and fall asleep and relax. I think facials is definitely right up my street. So yeah, that is it from us, guys. And drop us a message in comments. Which topics would you like us to cover in the future? And we will make it happen on this podcast.